Hello, this is Dr. Shilpi Reddy, Head of the Department, KIMS Cuddles Mother and Child Center, Kondapur, Hyderabad. Today we are going to talk about urinary incontinence. Urinary incontinence is a very difficult problem for women because it is not only a problem causing thing, it is also a socially problematic problem because it gives lot of low self-esteem and lot of problems for women on a social angle. And when it comes to urinary incontinence, treatment options are not very wide. And to treat urinary incontinence is not a small person's job. It is definitely a super specialty problem, and every person with urinary incontinence needs to come to a specialist for correct therapy and care. If you have to talk about urinary incontinence common symptoms, it is usually seen when there is lot of stress, there is urinary leakage, even on coughing, on strenuous exercises, on sneezing, or any activity that increases the abdominal pressure that causes leaking of urine from the urethra. Why it is causing this way can be explained in simple words. There is descent of the bladder, and when there is descent of the bladder and the urethra into the lower segment, because there might be various reasons, when there is an increased intra-abdominal pressure, due to the pressure there can be leaking of urine. And there are different types of urinary incontinence. There can be stress urinary incontinence and there can be urge urinary incontinence. If you have to talk about the causes of urinary incontinence, there can be a previous history of normal labors, prolonged labors, or labors which have been caused a lot of perineal damage. It can be grand multipara where they have had more than 2 or 3 deliveries. Not only this, any other problems causing lack of collagen tissue. They can have collagen vascular disorders or collagen tissue disorders where the support system of the bladder, the urethra, where the collagen tissue, the perivaginal tissues which give a lot of strength and bonding to the urethra and the bladder, they collapse. As a matter of fact, when this system collapses, there is a lot of descent and a small protrusion starts forming, and the bladder protrudes into the vagina and from the vagina outside. So this can cause a protrusion called cystocele. And there can be various stages of cystocele, grade 1, grade 2, grade 3, grade 4. And when the uterus also descends along with this, it can cause prosidentia, which is the uterus along with the bladder which is lying outside the vagina. Stress urinary incontinence or urge urinary incontinence have similar kind of a picture. But then there are slight variations. When you have urge of passing urine and you cannot control the sensation of passing urine, or when you cannot control the passage of urine, it causes urge urinary incontinence. When there is any raise in intra-abdominal pressure, that causes stress urinary incontinence. To diagnose these problems, there are uroflowmetry studies, and also clinically they present with this complaint. They either have problems of not able to hold urine causing leaking, or any pressure that causes leaking. So these symptoms and signs have to be elicited and checked. Along with this, there are also certain studies wherein the passing of urine and the residual urine can also be checked. These are a part and process of diagnosing the stress urinary incontinence. There are certain uroflowmetry studies which help in diagnosing. If you have to come for treatment options of stress urinary incontinence or urge urinary incontinence, they are specifically to the problem that is there. From my end as an obstetrician, the starting of any therapy is prevention. So for stress and urge urinary incontinence, there is preventive therapy. Whatever prevention has to be done, it has to be done during pregnancy and immediately after childbirth. The Kegels exercises, the urinary system, the pelvic floor exercises, the bladder exercises, the urinary holding exercises, which are called as Kegels exercises, have to be practiced even during pregnancy and immediately after a vaginal birth. So these exercises help restore the tensile strength, the tone of the muscles, and also the strength of the muscles. So these exercises help prevent further damage which is caused due to delivery. And lot of pregnant women do not know about these things. Whenever you are contemplating a healthy pregnancy, there are exercises which are directed towards the pelvic floor. Not only pelvic floor, the back strengthening exercises and all these. Along with these, you should have very good protein diet and also definitely good hemoglobin levels, because if your hemoglobin levels are good, if your diet is rich in protein, then the tissue tensile strength, healing capacity is also very good. So when the healing is very good post delivery, when you do exercises, the tensile strength of the pelvic floor muscles is improved and it comes back to normal. Though 100% restoring is not possible, but definitely you will not have a long-term problem like stress and urge urinary incontinence. And there are bladder dysfunctions and a lot of nervous problems and post other problems like, people can have stroke, people can have paraplegia and all these things. Those also can lead to these kind of problems. But generally, on an average, if you have to look into, more than 90% problems are related to birth trauma and post-delivery lack of exercises. So it is very, very important that prevention aspect is definitely looked into. And whenever you have an early symptom and sign, definitely you have to go to a specialist for care. Not only this, there are associated urinary infections, associated holding of urine and not passing urine completely, non-voiding, and recurrent urinary tract infections also, which worsen the problem of stress and urge urinary incontinence. So it is very important that you are in loop with your routine exercises, your pelvic floor exercises, your Kegels exercises, and also lifestyle habits which improve the urinary incontinence, because it is all about a healthy lifestyle that you have to inculcate better habits to prevent such lifestyle problems. And whenever there is an issue, it is important that you reach out to the correct person, a person who treats urogynec problems, so that you will have better edge diagnosis and also care.